most important thing are what I call the basic treatment guidelines. And I think of them as like health hygiene. We all know what dental hygiene is. We know that we need to brush and floss our teeth if we want to keep our teeth. And we don't get to just floss and brush our teeth on the day we go to the dentist. We do it every day, 2 or 3 times a day. So what if we had these daily routines that supported our bodies as much as we support our teeth and our hair? So they're focused in on the organs that excrete waste. So they take what's on the inside and put it on the outside. So your skin, your lungs, your gastrointestinal tract, and your kidney bladder system are your organs of elimination. So where do we start? Food is our medicine. Hippocrates said it. So looking at anti-inflammatory foods, organic whole foods, essential fatty acids, probiotics. These are different things I talk to my patients about. How to really optimize absorption and decrease inflammation. Water. These might seem very elementary, and probably because everyone's here, you know something about health, but it's amazing. Some people have no idea, and the difference that incorporating water into their daily regime impacts them. Water is the universal. 100 deep breaths a day, mindful breathing. That's inhaling for 2, hold for 2, exhale for 4. And just when we're stuck in traffic, when we're frustrated with our boss or our toddler or whatever, it's a great opportunity. Next slide. Movement and exercise. We live, for the most part, pretty sedentary lifestyles, and we've created that with all our technology and how we've structured our cities. It's hard to move around. But I think we all know it's a matter of doing how important it is to move the body, move the blood, move the lymphatics, and just help the overall system. Sleeping and resting. Sleep is so important, and not just like, you know, so we can not be tired, but during the time of rest and sleep is when the body repairs, heals, and regenerates. Hormones like growth factor, growth hormone, insulin like growth factor, melatonin, DHEA, all the hormones of restoration are at their highest when they're sleeping. When you don't sleep, they're not being released in the same proportions. Very, very important. Yes.
So question about sleeping in complete darkness. Well, I know why you're laughing. But I'm actually asking because I actually just found a night light and I put it in my daughter's room maybe about 2-3 days ago. Would it be better if I just took that out?
I think so. I mean, I always look, okay, what were people doing 100, 200 years ago? They were sleeping in complete dark. Artificial light had not been invented yet. Our whole evolution of developing, we were awake when it was light, and when it was dark, we had a fire or we went to bed. And unless they get old enough and they're scared, I say dark. Lymphatic system. The lymph is like the forgotten fluid. No one talks about lymph. No one thinks about it. We know about blood and, you know, saliva and mucus, but lymph is lost. But it is so important, and it's what helps us remove waste. It's where our immune system is really stored. I like to think about about the lymphatic system, you have a big city like Chicago, and we all know the major arteries and vessels that run through. But then you have the back alleyway, where everyone takes their garbage out. But we don't really know their names, but we do know if it's plugged up, it messes up the whole system. And that's like the lymph. So some basic things: dry skin brushing, really light skin brushing in the direction towards the heart, and also castor oil packs, which I'm happy to talk more about if you all want to know, are great ways to stimulate the lymph and help remove waste, detoxify the body, and enhance the immunity. And the GOLD stands for gut-associated lymphatic tissue, where 70% of your immune system is right here. Okay. Sunshine. 20 minutes a day for vitamin D. There's a lot of debate right now about vitamin D, but there's still a tremendous amount of evidence to show vitamin D is very important. You know, we cover up and lather up so much, we're not exposed. Again, 100 years ago, 200 years ago, think about people had a lot more exposure, and I think it's really important to be outside as much as we can in the 11-degree weather. This is my first Midwest winter in like 20 years, and it's kind of shocking. And then playing and laughing and having fun, because if we're not really, what's the point? It's, you know, we can all get pretty serious about different things, but it's so important to do something every day that makes you laugh, that you have fun doing, that you're passionate about. I think a lot of health is finding our purpose and our passion and what gets us through.
How would you see a person using your services as well as a medical doctor? Okay, so I think you're spot on. You work with nutrition and you exercise and you do what you can without using the medicine, without going to the drastic measures. I liked a lot what you said, that should be the conventional, not the alternative.
Right.
That made so much sense. But how do you see that working without a conflict? How do you see me as a non-medical person? How do you see me taking advantage of your services and having a medical doctor too? How do I do that?
Well, I think having a medical doctor is really important, especially, and I always encourage my patients to have an MD, at least or DO, absolutely. There for emergencies or just ongoing care and checkup, because my hands are tied in certain areas. Like, there might be a time I really want to prescribe antibiotics, but I can't, and I'm going to be really happy when you have someone you trust. I am very, very open to working with different people's doctors. And what I say about insurance is I accept insurance, but insurance does not accept me. So it's kind of the same thing. Like, I think the more open we are as patients, and I'm a patient as well. Like, I've got some pretty big health obstacles that I deal with on a daily basis, and it's being open and honest with them. That's what I was saying about building bridges too, like knowing where my strengths are and where I have expertise and where I'm limited. And then that doctor having the same expectations of themselves. Like, I know a lot about this, but I might not know much about